New week, new topic, new series. Nick and I wanted to discuss a little bit about how to properly communicate with our patients in the healthcare system. More often than not, we hear these stories from our patients about how their provider told them that their hips are misaligned, they have this degenerative joint disease, but they have no idea what this term means, or that their MD said that their x-ray images were the worst that they've ever seen before. Some doctors and other providers tend to use this verbiage that can be both psychologically demoralizing and very conducive of fear. To me, as a provider that's very up to date with the research in our field, I find this to be ironic because there's a large amount of evidence that links psychological factors and recovery rates, and this is something that I become very cognizant of throughout my treatments of my patients on a day-to-day basis.
Yeah, so when we talk about how we speak to our patients, Owen brings up a lot of great points. There's been a huge push in research lately, highlighting the importance of the therapeutic alliance. Papers talking about the level of preoperative anxiety as a predictor of recovery after rotator cuff surgery. Certainly a ton out there about depression and mental health as a prognostic factor for low back pain. And that really just makes me think, we have to be so careful with how we decide to talk to our patients and explain their injuries and their plan of care. They're going to remember so much more about, how we speak and interact with them rather than what special tests we're performing. And in a world where we're trying to get everybody better, and as quickly as we can, this is one thing that's going to make it a lot easier for both the patient and the clinician.